Dr. Gwendolin, please can you give us a scientific explanation of how pandemic occurs and how to manage using a combination of lifestyle changes, medical intervention, hygiene, and vaccines?
So a pandemic is actually a global outbreak of an infectious disease that spreads widely over the globe and affects people and causes a lot of morbidity and mortality. And it also results in disturbance in our social, economic, and political system. COVID-19 is not the first pandemic that has been experienced worldwide. We've had several pandemics ranging from cholera pandemic 1910 to 1911 with mortalities of about 800,000 people. We've also had flu pandemic in 1968 by the influenza virus, which resulted in mortalities of about a million people. Then the Asian pandemic, which is the deadliest pandemic that the world has experienced, that occurred in 1918, where 1/3 of the global population was infected, and the mortality of up to 20 to 50 million people. The HIV pandemic that also occurred in 2002 to 2012 had mortality of about 36 million people. So having another pandemic is pretty new. But as things are going, there are evidence that suggests that we might likely have more pandemics as we progress with life because of change in activities like increase in global travels and integration, urbanization, and changes in exploitation of our natural resources. This might lead us into much more frequent pandemic than we had expected. Well, the about pandemic is that usually it's a new disease, a new virus. It's a new virus. People have not built immunity against this virus. Everybody is actually at risk. But from studies, it has shown that the people that are of high risk are usually elderly and people that have other coexisting diseases like diabetes, like hypertension, severe asthma, and other diseases that we cannot mention, heart diseases, chronic heart diseases. So these people are placed in a position of high risk. They are the ones that are usually affected by the disease, though many more people are infected. And it's been shown that of the total amount of people infected, about 80% of people usually recover, 80%. So the mortality is not really as high as people think. And I think that is very comforting concerning this virus. To know how this virus spread, there are different types of virus, so their mode of spread are usually different. But in light of COVID-19, is actually transmitted by droplets. Droplet means that it's being transmitted by secretions that are being brought out through sneezing or cough. The fluid that you secrete out of your body through cough or when you're sneezing. What do you mean by this now? So if the mode of transmission is from person to person, that's transmission, or from person to surfaces, and surfaces, when people get contact to that surface, they can infect themselves. So these are the two major ways in which COVID-19 particularly is being spread. This is how the pandemic occurs. So first of all, we have to also understand the symptoms of these diseases so that we can be able to apply our hygiene and our lifestyle modification to shorten the spread of this disease and to cut off the pandemic. First, the symptoms of COVID-19, they are commonly cough. The patient will present with cough. The patient might present with cough and sneezing, yes. Then the person might also present with fever, high fever, and then the person might have difficulty in breathing, chest pain. So once somebody starts experiencing such symptoms, then the person can call the doctor or health practitioner to explain symptoms which will be determined if it is COVID-19 or not in our health as we move forward. So what are our lifestyle modifications? Looking at the mode of transmission of this disease. First thing we want to talk about at social distancing. Social distancing it explains that people should at least stand about 1.5 meters away from each other. This to prevent transmission of this virus from one person to another, as the person cannot just sneeze into your face or get in contact with you. This will reduce spread. We also want to talk about regular washing of hands and soap for at least 15 minutes, 15 seconds, 15 to 20 seconds. Yes, wash your hands thoroughly with soap for 15 to 20 seconds. After we advocate on use of alcohol-based sanitizer, frequently use alcohol-based sanitizer to sanitize your hands. As we said, transmission can be indirectly gotten. You can indirectly get COVID-19 because it could stay on surfaces like doorknobs, hard surfaces like tables, like your phone. So we advise that these surfaces be cleaned with disinfectants. Commonly, what we have in Nigeria, we have hypo and jigs. What we do is we put them in water and clean our table surfaces and other surface, the doorknobs and every surface that we can, like switches. We can clean everywhere with them at least every 2 to 3 hours to ensure that this virus is not on that surface because those disinfectants kill the virus. So we also go to talking about if you are coughing or sneezing, you are advised to cough into a tissue paper and then drop the tissue paper carefully in a proper dustbin. If you don't have a tissue paper to do that, we advise you to cough with the upper sleeve of your cough into the upper sleeve of your hand so as to reduce spread of the virus. Apart from these hygienic practices, normal hygiene of keeping our environment clean also help us to prevent the spread of this virus. Secondly, we want to talk about how to the medical section, the doctors, the frontline people manage COVID-19. Before they will be able to get a patient that has COVID-19, the patient must have at least complained of such symptoms or maybe from contact tracing from another infected patient. So once the patient calls the doctor or meets the doctor and has complaint, the doctor will direct you on the appropriate things to do. You call NDC, NDC, you call NDC with the various numbers that the federal government has given us, so we can have care. We want to look at the vaccines. Presently, there is no really medical treatment protocol for the management of COVID, but there are some steps when you are in the facility, they apply it to the patient to make sure that the patient gets function of vaccines. Vaccines are very important, especially in management of pandemic because it goes a long way. But for now, COVID-19, there is no, the vaccines are still in progress. They are still working on getting vaccine for COVID-19. So we advise everyone to observe all the protocol that protocols like isolation, hygiene protocols, so as to reduce the spread of the virus. Vaccines are actually they are actually the virus that has been denatured. They are actually the virus that have been denatured and then injected into the human system to create an immunity, to cause the person to generate an immunity, generate a system that is immune to the virus. So once the virus comes close, the system is able to fight it. But we are looking at and hoping that these vaccines will come on as soon as possible. But for now, the advice we give to the public is that please stay safe, observe all the hygienic protocol that has been said, and then